is it possible for hyperacusis to go away? I know it was in my case, but is it more than possible for it to go away?
Yes, so it is. We especially find this with children. They grow out of, I wouldn't necessarily say grow out of it, but their auditory system adjusts with a lot, sound therapies and getting used to sounds again. And we found that with adults as well, that hyperacusis, can, if you slowly increase the sounds you're hearing and you slowly go back in, because one of the things that people that experience hyperacusis might do is to isolate themselves very sensibly. Your fight syndrome comes in and you protect your ears like you were doing, and you might not interact with society in the same way because it all hurts, it's painful. So then you need to readjust your ears back into sound, basically. So it's about upping your sound, and what we found is as people have done that, they've slowly got their hyperacusis will slowly get better, and it can, in your case, go and not necessarily come back. I've had patients where they felt like it completely gone, and then they can have another occurrence where they've gone somewhere so one patient told me that they went to a concert, it was too loud, and the hyperacusis was back and it was worse. But we have ones where we have young patients and teenagers where they've just adjusted and they don't experience it anymore. So it is slightly different to tinnitus, that we know that there is this adjustment, that it definitely happens. We know that it will come completely go.
There is a lot of fear, isn't there, associated, you were saying that earlier with hyperacusis, and I see it quite a lot amongst my friends and colleagues in music or any kind of art form where noise is involved, particularly when that might also be your career. So that makes the exaggerated feeling of anxiety a lot worse. And I knew that with hyperacusis, it really, really did make it really, really difficult to get my head around it, because I was also fighting to keep a career, and the career was involved in sound. But for me, it was the sound therapy, which I'll get onto a bit later on, that really helped me, actually, bathing myself in white noises and sound therapy itself, which I made it for myself. I found that by just creating my own sound and feeding it back to me, it really helped to distract and to desensitize my own tinnitus. But I found one of the most important things going back to that was this lovely woman called Penny Stannard, who really helped correct my way of thinking by just giving me wonderful clinical information.